Hi, everyone, and thanks for tuning in this week to our blog. I want to start off by saying that I'm so grateful for the amazing work that you all do across the province. Day in and day out, I see and hear examples of your skill, compassion, and dedication, and that includes our 14,000 plus volunteers who donate in the neighborhood of 1 million hours of their time each year to supporting patient care. Their invaluable contributions make a difference to our patients and their families every day, whether it's acting as a wayfinder for patients, running a gift shop, providing pet therapy, or any number of activities. While COVID-19 has affected our volunteer programs, the importance of their contributions to our health system is unchanged. Our patient and family advisors are also key volunteers in the system, and their input helps us ensure our health system meets the needs of the individuals we serve. They continue in that role during the pandemic, including consulting on our virtual health strategy and practice guidance through the Patient and Family Advisory Group. Joining me to tell us more about the work of volunteers and patient and family advisors are Dean Radbourne, who's the co-chair of the Patient and Family Advisory Group, Michele Rondot, manager of volunteer resources in Calgary Zone, and Stephanie Stock, who is a South Zone volunteer. So welcome to all of you, and thank you so much for joining me today. So Stephanie, I'm going to start with you. How did you come to volunteer with Alberta Health Services, and what exactly do you do?
I started volunteering because I watched an old episode of Family Affair when I was still growing up on the farm, and Sissy was the niece, and she decided to be a candy striper at the hospital, and it just looked like a lot of fun. So I called Tyrone in Medicine Hat and got on as a volunteer there, and I volunteered as a volunteen. And then later, I helped LDR with their paperwork, getting it organized. And then I volunteered in dialysis, visiting patients, and then I became a wayfinder. And then I moved here to Lethbridge and I started volunteering in diagnostic imaging and wayfinding.
Wonderful, Stephanie, and I bet you have such a positive impact for so many of our patients and families, so thank you so much. Dean, I talked a bit about the Patient and Family Advisory Group earlier, but can you tell us a bit more about its role and who are involved?
We are made up of volunteers from across the province. We've strategically spread ourselves out from rural to urban municipalities, covering all zones. And we work together to bring some sort of lived experience messaging to AHS as new policies are created or as guidance is required. And yeah, we're excited to sort of reflect Albertans and speak on behalf of Albertans and keeping patient the patient experience front and center for all AHS.
Michele, unfortunately, we had to scale back some volunteer services early on when COVID hit. So, what kind of factors went into that decision, and how do we keep our volunteers engaged during that time?
At the time of when COVID first hit, the key driver behind minimizing or actually closing many of the volunteer programs was paramount focus on the safety of the volunteers, staff, and patients, plus an overall goal to minimize just the traffic on the sites. It's important to note, though, that some of our programs didn't close down. Our volunteers continue to support a variety of programs, including Meals on Wheels, No One Dies Alone, virtual visitation, just to name a few. But then when our volunteers were not coming into the facilities, we wanted to make sure we stayed in touch with them. And we used a variety of standard techniques, phone calls, emails, newsletters. But I wanted to mention one very creative method that involved virtual networking with patient and family advisors by my team here in the Calgary zone. The team introduced virtual wellness sessions, how to stay well, wellness tips, guided meditations, which were really quite well received. Plus, I have to mention, the volunteers were very appreciative to receive your daily COVID updates.
Wonderful. Thanks so much, Michele. Dean, I know that the Patient and Family Advisory Group has been working with us on a number of programs and initiatives during the pandemic. Could you give us a bit of an overview of some of that work?
Of course, as AHS and all of Alberta really was forced into becoming very nimble very quickly, and new decisions about patient care had to be made. We were excited to maintain our involvement in all those decisions, and that meant that our group had to become very available and accessible whenever it sort of was needed. We're very proud to say that our group had more than 100% increase in the amount of consults that we saw. We've seen over 42 consults since the pandemic began. And we feel that the AHS has continued to be very receptive to the opinions and the thoughts and the feelings of patients and families. And so we want to make sure that we can continue to provide that. Like mentioned before, virtual health has been obviously something we've been heavily involved with. Visitation and patient support guidelines and areas like that. We've also been really excited to be part of the consult about moving forward. What can we take from COVID? What can we continue to do to improve our health system and primarily access to all of Albertans, whether it be technological or physical restrictions or even just distance barriers. So yeah, we've been very busy, as my family will tell you, lots of meetings, but it's been great. I'm very proud of the work our team has been able to continue to do during the pandemic.
Michele, a bit of follow-up to my last question to you. What went into reopening of the volunteer programs in June? Because that must have been a lot of work.
There were actually quite a few factors that went into the decision to reopen the volunteer programs. One of the primary ones is that there were a lot of calls and requests from the departments to have the volunteers returned because their contribution was just so greatly missed. So while the programs were shuttered, Volunteer Resources as a whole, we worked on a return to volunteering during COVID training program that if you wanted to come back and volunteer with us at this time, you were required to take. The training focused on like the key concepts the volunteers had to become familiar with: the daily screening, the continual masking, the need for social distancing, the emphasis on hand hygiene. Plus, even before we could let a volunteer step back into a program, we had to review it and make sure that it met all of the current constraints. So as an example of program changes, when the Red Thread gift shops here in Calgary reopened, they had to redo their entire store layout to maintain social distance. They had to figure out new way to process the transactions, which involved not quite a bit of like kind of a plastic tray on a stick, handing it back and forth, and also just to limiting the overall number of patrons in the store at any one time.
And Stephanie, last question goes to you. So thanks very much for coming back to volunteer. So my question is, when were you able to resume your volunteer role and how are things different now?
I was able to come back at the end of June, and things are different because I did have to go through some training or like a module before I came back about COVID and learning about the mask and things like that. I think coming back, I think the biggest thing is just remembering to fill out the COVID form, just to say that I don't have COVID and whatever questions are on there, and just making sure that I wear a mask and I'm sanitizing and washing my hands. And yeah, and then otherwise I just help patients find their way in the hospital, or I help them get ready for their exam and diagnostic imaging.
So want to thank all of you for coming on today, and thanks to all of our volunteers and patient and family advisors across the province. Earlier today, we celebrated long service awards for employees, physicians, and volunteers who had been with AHS for 40, 45, 50, and 55 plus years. And for the 55 plus year group, 6 out of the 8 recipients were in fact volunteers. So Stephanie, I don't think I'll be around when you celebrate your 55 years of volunteering, but I just want to let everybody know that we are so grateful to all of you when you choose to give your time and talents to supporting healthcare in Alberta. Your efforts make a huge impact in the lives of our patients, their families, and for our staff and physicians, and we could not do this without you. So thanks very much for watching, and we will see you again next week.
Together, we do amazing things every day.